You're listening to Healing Voices Project, where we share stories and the latest information from people who fight addiction every day. I'm Mike Torville, your host and author of Voices from the Fallen. Thank you for listening, for following, and most of all, for sharing with people you care about. Make your voice count too. Hello everybody, thanks for coming back to Healing Voices Project. I'm Mike Torville, your host, and today again we have another guest, Joy Ifill from Behavioral Health Network, otherwise known as BHN. Joy is a licensed independent clinical social worker with over 20 years in the field, and currently Joy is a vice president at BHN, where she oversees community behavioral health centers, crisis service line, including their mobile crisis intervention teams and community crisis stabilization programs, and there's a lot more to that. But Joy, thanks for coming on.
Good morning. Thank you for having me.
Sure.
Excited to be here.
Sure. And now with your role, you oversee a lot of services, and I'll read them because I can't memorize them because there's that much. But you oversee the mobile crisis teams, trauma response teams, behavioral health urgent care, peer-led drop-in center, community crisis stabilization programs, outpatient mental health clinics, and telehealth mental health programs. That's quite a bit. Busy. All right.
Many years I've been doing this. So
Yes, 20 years. Well, you've been in the field for 20 years. How long have you been at BHN?
I've been at BHN. It'll be 4 years in December.
Okay, wow. So you've seen a lot in
Yes.
your 20 years of experience.
Yes, but
Yes.
the last four,
Yeah.
because I came in December of 19 and we went into a pandemic 3 months later.
Oh, yeah.
So I've grown vastly. A lot in the 4 years.
A lot changed.
Right,
Yeah,
that
yeah.
we all experienced,
Yeah.
but yes.
Now, BHN, a lot of people are familiar with it, but can you give a quick overview of what BHN is all about and what...
BHN, Behavioral Health Network, is one of the largest not-for-profit organizations in Western Mass. They provide an array of services from substance abuse, mental health, developmental disability services. So they service from pediatrics, they have early intervention programs, all the way through adulthood. So they provide all of the continuation of services in the behavioral health field and have a large footprint in the community.
And today we'll talk a little bit about the addiction, substance abuse, but you're more than that, obviously, with mental health, behavioral health.
Right.
A lot of mental health programs aside from addiction. So it's not just about that. I just want to clear that, right? Yeah.
Right.
And BHN's been around for how long now?
Oh my gosh. Before I came. More than 20 years. 30?
30-something?
Yeah. It's been a long time.
In fact, in my little bit of research I found, and it was around much longer than I thought, since the early 90s, and it was a merger of 4 different organizations. That,
right, and it continues.
Yes.
And BHN continues to grow. In fact, in my 4 years of being there, we've merged with some other companies and continue to plan to grow. So it started off, as a very small, by Kathy Wilson, and then just has grown over the years and continues to grow.
Yeah, you have locations all throughout Massachusetts?
Yes, and we actually now have Western Mass is our primary area, but we do, because of acquisitions, we now actually have a substance abuse program in Dorchester, Mass, so in Eastern Mass.
Okay, and based out of Springfield for the most part. I mean, that's your
Our corporate is out of Springfield,
Yeah.
and the majority of our services are in Western Massachusetts.
Yeah, and recently I've met several members of your team. Michelle, who's great.
Yes.
Katie, who we talked about
Yes,
earlier,
Katie
who
Patterson,
runs the living room, who hopefully is on to talk about the living room, because what
amazing.
a wonderful program that is. Yeah.
That is an amazing program. That is a peer-led, so people with lived experience, people in recovery from mental health, their own mental health. leading a drop-in center.
Okay.
So anyone in the community can come in, just get support from another peer who is also has a history of mental health. They can get food. They can access to a computer if they need to, look for a job. It's really a wonderful, supportive program for people in the community.
It's very homey looking.
Oh, that's why it's called a living room. It literally looks, I wish my living room looked like that. But it is very homey. They can take naps. We have day beds if people need to just kind of rest. It's a great environment.
Yeah, you see the pictures, and I want to cuddle up under a blanket and watch a movie in there. It looks very comfortable.
Yes, it is very comfortable. It's home for a lot of people.
Yeah. Well, you've been in it for 20 years, in this field for 20 years, working for different organizations, and now BHN for 4 years. What brought you into this field to begin with?
My own personal experience. I have a family member, my mom, had struggled with depression all her life. So as a little kid, I can remember my mom struggling with depression, my dad struggling with trying to get her access to care. She she's still alive, has been hospitalized multiple times for her depression because just her inability to care for herself at that time. And I just remember, my dad particularly having to try and navigate that whole system to get her help, while also trying to take care of my sister and I, and just what that stress it put on him and on our family, extended family. And so I always say, I think I was a social worker from a very young age.
Yes, before you even knew it.
Before I even knew it.
Yeah.
But mental health, and particularly crisis work, which is my passion, I know is based out of my experience of my mom's inability to get timely access to care in a time of crisis. And so I think that's what really drove me to this work.
Yep. And your mom, how's she doing?
She's wonderful. She's 80. She's beautiful. She's, still, it's, mental health is a lifelong struggle, but she is in recovery. So she's doing well.
And as you grew up and saw this, certainly with what you're doing now and the profession you're in, but do you see differences in how she's coping with it, your family's coping with it, than it was when you were younger?
Oh, yes. It's particularly with the change in the way that Massachusetts is delivering healthcare through the community behavioral health centers. I think about if my mother, God forbid, were in crisis again, how the ability for us to get her help would be so much more efficient, more caring, and more timely than it has been in the past. In the past, you would have to take your family member to an emergency room, right? Which that is
it's an experience
in itself, right? It taxes the healthcare system unnecessarily. It's time consuming. I know when we were younger, my dad then before he could take her to the emergency room, he had to coordinate to get family to come in to watch us. So it was never timely, right? It was a lot of coordinating in order to get her help. And while he's trying to coordinate all this, she still is decompensating. So it's very stressful. Fast forward to now. If a family is in crisis or has a loved one in crisis, there are many options through the community behavioral health. The first one being mobile crisis teams, where we come to you, right? Which if we had that would have taken off about 90% of the burden for my family. So if a family has a loved one, or if they themselves are in crisis, they can call us and we'll have a mobile clinician come out to the home to do the assessment right there. So you don't need to leave your home. So that is huge.
So, Joy, there's a phone number that people can call for the mobile crisis unit. What is that number that you could call?
It's 413-733-6661.
413-733-6661. That's for the mobile.
Right. That will get you to, we have a call center, and you will speak to somebody and tell them what's going on. And then if you're requesting the mobile, they will then transfer you to our triage staff, who will gather your information, where you live, what's going on, and then we'll deploy or send out a clinician.
Okay. And the types of situations that would warrant a call like that. Can you describe a few situations?
Anyone that is in crisis that is just needing to talk to someone to figure out what services or what help they might need to help stabilize the crisis. The one caveat is it has to be voluntary. So the person has to be willing to speak to the clinician who comes out. If they are, other than that, we will come out regardless of what's going on and help figure out what services need to happen in order to stabilize whatever's going on.
Okay. So from that phone call, they'll assess what happens next. And
Well, right, and then send somebody out. The real assessment happens when we come to the home. The phone is just more of like a triage screening.
Yep.
And then.
Got it. That makes it. And also the website, too. They can learn. It's bhninc.org.
Yes, they can go there and learn about all the services that Behavioral Health Network offers, but also the CBHC and how to access services.
Yeah, there's a lot to the website.
Yes.
There's a lot of information and services there. And I think about this a lot, too, after all these years, and honestly, relatively speaking to what you've put into it, how I've been involved with this, I see a lot of changes in the past couple of years, but in your 20 years, you must have seen so many changes. And even now, I think about the challenges you face now, currently, that are different from 5 or 10 years ago, and how you dealing, what are some of those challenges, and how are you dealing with them?
Mm-hmm. The biggest challenge that the healthcare, the behavioral healthcare, but I think actually everywhere is staffing. There's the staffing.
Really?
So there is, as a result of the pandemic, there is a huge short, and this is not just Massachusetts, it's nationwide, of behavioral health providers. And so we're all really struggling and finding qualified staff for these positions, for our mobile team, for our urgent care team, we have any clinician team. So that is the biggest struggle that organizations are having is finding staffing and the resources for the programs.
I see a lot on social media looking for positions like all the time. Recovery coaches,
everywhere.
Staff, any kind. Yeah.
Never seen this before. The level of vacancies.
Yeah.
And trying to figure out where did everybody go.
Yeah.
But I think the pandemic for a lot of people has really they reevaluated the type of work and how they want to work. Mm-hmm. And a lot more providers are going to the telehealth, the remote positions, which are great, but crisis work and they can't be done. We do offer that for those that cannot come in, but the vast majority of people want face-to-face, need face-to-face. And so it's hard because a lot of the mental health providers want to just work remote work.
See, I wouldn't have thought that would be what you answered was staffing, but now that you say it, I say, well, that
huge.
Makes perfect sense.
It's the biggest barrier.
And how about, think about access to drugs, access to, at a young age and how quickly and how prevalent this is now.
Right.
You find that as a big difference from even just 5 years ago.
Well, yes, and then you add on to the vaping, and I have adolescents, and I see within the school systems the vaping and not only vaping of cigarettes, but vaping of the marijuana, right? That has become an epidemic, and that kids are vaping at an earlier age because they now are using the vapes and having them in fruit flavors, and it's very predatory if you really look at what's happening. And so children are at a younger age being exposed to marijuana, doing it in school, in the bathrooms, and back in the day it was
Well, there's a couple things. One, it's more accessible. One, because there's more of it meaning the drugs, whether it's fentanyl and heroin and other drugs, but also too through social media channels, the ease of being able to find out where to get is so much easier.
It is. It is very. Our living room services a large population of our living room are homeless, and it's very sad, but all of our staff have been trained on a lot of staff throughout Beach and how to administer Narcan, and at least once a week they're having to administer it because of overdose, on property, and so that is, I'm sure Katie will talk about that, but that is something that our staff have to deal with on a regular basis, is helping people when they do overdose or and being able to try and stabilize them in the moment and then get them.
And of course, we talk all about the fentanyl. It's predominantly fentanyl now, except now you have xylophenone. That's really pretty dangerous stuff there.
Right. You don't know. I mean, people don't know what they're getting and what's in, and that's the risk, right? And that's where people are, accidentally overdosing because they're thinking they're getting one product, but then the product is mixed with other things, and it's extremely, extremely dangerous.
Yeah, I suppose it could be very discouraging because I think about for example, how much you've expanded and how much of a difference BHN is making, besides the addiction issues, but in mental health, and how much progress you're making. But at the same time, are you discouraged at how rampant things are now and how out of control things are now and the increase of overdose deaths? How do you stop from being discouraged despite all the good work you're doing?
Okay, I can speak for me. There's hope, right? I think if you can save one person, one family, that's a difference. I think that with and our addiction services is amazing, and we're growing. Like I said, we have a treatment program now in Eastern Massachusetts, and it's just you reaching one person at a time. That's really how I keep myself going and not get so overwhelmed, because it is. You read the news, you see the number of deaths that occur, and the people involved are getting younger and younger. So it's really about I try and maintain hope by just focusing on the people, the populations that we're able to help at BHN. I know that BHN, though, on a systemic level is really working with other organizations on trying to affect some sustainable change. So it's like micro versus macro level change, and so I try and focus on the micro and let Steve, our CEO, do the macro level.
You can get overwhelmed with the macro.
It is overwhelming.
Yeah.
It is overwhelming. It's overwhelming. It's daunting. But I think when we focus, when I hear stories of our living room staff administering Narcan and saving lives, that's what gives me hope, right? Although it's sad that person had to experience that our staff had to experience that, because it is very traumatic for them. Like that's not what you signed up for when you came to do this work, right? No one is a medical professional, but and I like to check in on them to see how they're doing. And when you hear them, that's part of why they come to work. Like, it's like the ability to help somebody. And if there's no greater help than being able to bring somebody back from an overdose.
So you have to really focus on the success stories.
You have to, because if you don't, you'll get lost and overwhelmed and then feel immobilized, and then you're not effective. So. And
then show up for work every day.
And then.
Despite,
right. Yeah. And either be apathetic or just burnt out. And.
Do you find that that's, sort of off the topic here, that the burning out, do you think that's happening with a lot of people? And certainly contributing to the staffing issue that you mentioned earlier. But how do you cope with it? That discouragement or that burning out of employees facing that every day? Yes.
And one of the wonderful things, among many, but that BHN focuses really on that. We actually just started we have an employee wellness committee that really focuses on doing things to help keep our employees well, emotionally well. But we also are starting a kind of drop-in groups to help people, with early to prevent the burnout. So that's something that we have are getting ready to go live in the next couple of weeks. So that will be able to provide a space for staff to go to drop in and just kind of check in. It's run through our trauma response team. And so the focus is on preventing burnout for our staff. So those are the things that we're trying to do, that we are doing to help staff. My team also on the crisis team created they call it the relax room, but it's like a sensory room where if our staff have either a difficult call or a difficult assessment, they can go into this room that they have like the sensory, music, and the lights are low, and we have a massage chair, and just to be able to kind of disconnect for a little bit and kind of ground themselves to be able to go back out there again. So we are really the wellness of our staff, because we know that when staff burn out, we will lose them. So it is definitely in the company's best interest to invest early and be proactive versus reactive, and ensuring that our staff have a really balanced between work and personal. And so are investing those resources to do that, to be able to retain the staff we have, because we do know that there is a shortage. So we want to keep who we have.
Yes, right. If you have the compounded problem of not being able to get staff, and the staff,
the last thing you want to do is burn out the ones you have. Right, exactly.
Right. And when you talk about the crisis response team, facing those types of things every day can certainly wear on your, and so talking about what typical day, which I know it's not the right question, but talk about the crisis response team. What do they do, and what is a typical day for them? Yeah.
So our crisis staff are all mobile, so they are deployed. They start their day at home, obviously.
Yeah.
They call in and they get their first call. We deploy people by their geographic. So if somebody lives in Agawam and there's a crisis call or needs assessment in Agawam, they would go there. So they call in.
And the crisis call, it could be an overdose. Or what types of crisis?
The crisis call would be somebody who is in crisis. So it could be they might be having thoughts of harming themselves. They might be, like my mom used to be, just profoundly depressed and the family's concerned because they're not doing well. Yeah. It could be substance related.
Okay.
So a family member who has an addiction and the family wants them to get help.
Got it.
Not necessarily an overdose. That would definitely be a hospital 911 type of thing.
Okay.
But so no medical emergencies. So then we deploy a clinician, and we have two teams. We have an adult team and we have a youth team. Our youth team, who responds to any under 17 and under, we send the clinician, but then we also send with them a family partner, which is a person who has lived experience of caring for a child with a mental health or behavioral health need. So the clinician will go out and assess the crisis, the what's going on with the child. The family partner is really there to support the caregiver, because those that having your own child in crisis is stressful, and so the family partner is there really to support the caregiver or parent, to kind of just help them be able to kind of ground themselves and to be able to deal with what's going on. And our adult team goes out with the clinician. And so we go out, we meet with the family or the client and just talk about what's happening, like what is going on. And we do a formalized assessment. So we assess risk, so safety, suicide, homicidal. We look at like what services are currently in place, medications, etc. And we make a clinical determination regarding like what would need to happen in order for this crisis to be stabilized. It could be the person just needs to get talk to someone. They're not in therapy. So part of our CBHC, we have an urgent care where a person can just walk in, and this is one of I think the game changers. Historically, to get in therapy, you have to make an appointment. There's also a shortage of therapists right now because they're right. Yeah. So now a person can just walk into our CBHC. We're open 7 days a week, Monday through Friday, 8 to 8. On the weekends, it's 8 to 5.
And where is it?
It's at 417 Liberty Street.
Okay.
They can just walk in. They will see a clinician and just talk about what's going on. We do brief solution-focused therapy, which are time-limited sessions. If the person needs longer, they can continue on, so they can have immediate access.
And you just show up.
Just show up. For people like that, like example of my mom, who really needed a little bit more than outpatient at that time, she really needed her medications adjusted. Instead of going inpatient, which right now there is a bed shortage across the state,
of course, right.
So people will board in an emergency room for days waiting. We have a crisis community stabilization programs, which are inpatient. Average length of stay 3 to 5 days. A person can get admitted immediately into that, see a med prescriber, get their medications adjusted, and get back out there. So that is, and we don't have a wait list for that. So people can be assessed and admitted same day.
Okay, you had mentioned there was a lot there.
Yes,
but that's good. That's a lot of information. And you talked about the shortage of beds, and it's getting worse now, because I know even Mira Vista has closed a lot of their beds as of this month, I believe, or this.
And again, all this is based on staffing, right?
Yes.
We don't have enough staff to run, for the unit, so they have to downsize because the staffing is having an effect all nationally, and the quality of care and how care is being delivered. That's unfortunate.
Yeah, that's tough. You also have services with medical assisted treatments like methadone.
Yes,
right?
yes.
Can you talk a little bit about what you do with that and the different types of programs you have with
So we have the medication assistant treatment, which are on site. People come on site, they get their methadone daily. We also, in our crisis stabilization are able to do what's called induction. So if a person is already on methadone or needs to start on it, they can get that done while they're in the crisis stabilization program, which historically we've not been able to do. And substance abuse and mental health go hand in hand. Right. So in the past, if somebody was on methadone and they were in crisis suicidal, we were not able to admit them into our crisis stabilization team because we didn't have the medical staffing to be able to support their medical needs around their medications. And so now we do have 24-hour nursing staff, and so we can take a larger group of people, and one of them being people who are on inductions and on methadone.
Okay. And you're also partnering with other organizations too, right? It's Behavioral Health Network.
Yes,
which is a network of...
We partner with a lot. I mean, we do partner with a lot, but we also, because we are so large and we're growing, that we pretty much... are, I would say, sustainable, right? Self-sufficient. Yeah. But we do partner with a lot of smaller community organizations because we know that we can't be everything to everybody.
Right.
And partnering, again, with particularly community providers works best for the community members.
Yeah. Now, there's so much, and there's so much more. We could talk for hours. I know that because you've got so much. But if anybody wants to learn more about BHN, first of all, it's BHN Inc., BHNINC.org.
Yes.
This website. And the phone number, again, I'll read it, is 401. This is the main phone number?
Yes, you'll be taken to we have a call center, and then you'll just speak to the intake specialist and tell them what you're looking for, and they'll navigate.
413-733-6661 for BHN. Well, we talked about a lot, Joy, and I know we're going to have either you or others from BHN on to talk about some of the programs more specific, like the living room and other programs. But I think you provided a great overview, and I appreciate you coming on.
Thank you
so much.
It's wonderful being here.
Yeah, and also too, just for coming on, I'm going to give you a copy of the book, Voices from the Fallen. I don't know if you've seen that before, but
thank you very much.
8 different stories.
Oh, that's wonderful.
In fact, this is what led to the podcast.
Okay.
So, appreciate any commentary.
Absolutely. Thank you very much. And thank you for, doing this.
Sure.
I'm in this field. This is my profession, but it's wonderful when people who are not mental health professionals understand the significance of the impact that mental health and substance use has.
Sure. And I think, what started this is, when you start to get exposed to it, when you start to learn about it, it's like drinking from a fire hose because you get overwhelmed with, wow, I didn't realize it was this bad. It affected this many people. And I found that you can hardly find a family that's not affected.
No,
you
right.
Can't.
Everyone is affected, either
mine
directly.
Included, yes.
Directly or indirectly. This is a community. This is a national problem. Right. This is not just right. So thank you.
The word, sure.
Thank you.
And I'm glad you guys you're here with us. So we'll be talking all along. But again, thank you, Joy Ifill from BHN, and appreciate everybody for listening to Healing Voices Project. Thanks for coming, and talk to you soon. Thanks.